So see, this is the position of the patient. She is 38 years aged lady, is suffering from the trigeminal neuralgia for last 5 years with the pain sensation. There is electric shock like sensation and mostly covering the maxillary and the ophthalmic division. So here we can see the foramen oval. This is the foramen oval. Okay, not always very clear, but here for this patient, as the patient is young, the foramen oval is clear in this portion. Next, here we have first located the foramen oval. Now we have paint draped and we are trying to see, this is the foramen oval. Can you see my needle cursor tip? Here is the foramen oval. So with the surface marking, we are coming to the foramen oval. Okay, this is the mandible and this is the submental view. This is the mandible, this is the maxilla. This portion is the mandible. Okay, let me annotate it as well. Now, next is the local anesthetic injection. So what I have drawn, this is the margin of the mandible and this is the margin of the maxilla. And in between here, you can see the foramen oval. Okay. So maxilla is in the medial side and mandible is in the lateral side. Now after injecting the local anesthetic, now we are putting the radiofrequency needle. Here you can see I am putting one finger inside the mouth and I have used double gloves as well. So that after it crosses the oral part, I will take one glove so that my hands remain sterile. Okay, because otherwise there is a chance that your needle may go into the oral cavity. Then there is a chance that this commensals from the oral cavity, they might move, bacteria from the oral cavity might go to the near the brain. We should avoid that. So now we are putting the needle that is going in. So now we have done an intermittent checking as well. Here we are able to see whether we are at the right direction or not. But here we checked much superficial. Here is the needle tip here. Okay. In this location, here is the needle tip. Then we are sure that our direction is perfect. Then we are further moving in. Again, we are coming back to the previous position where we are able to see. Then again, after going certain distance, we are checking whether we are at the right position or not. In this patient, you are still able to see this is the sella turcica, this is the posterior border. Now this is the clavus, and this is the what I am drawing in the blue is the petrous part of the temporal bone, and this is the needle direction. Okay, I am drawing in red. So this is the needle direction. So we are sure that it is going at the clephopectoral junction. Going further in. So here there is an important step that not only putting the needle is enough, because here we know the location is at the maxillary and the ophthalmic division for this patient. So we need to put it at the center and slightly towards the medial side, and so that our sensory stimulation, actually there is paresthesia along the mandibular division. That is very important, because here we have already put the cable, so you can see the shadow of the cable as well. So that is the probe, radio frequency probe. And next we are going for the stimulation. First we are asking for the stimulation, and whether it is matching or not, we will be asking to the patient. And then we will be doing slight manipulation so that if it is going towards the initially, it was going more towards the mandibular side. So slightly we have moved towards the medial side. And then, because it was initially towards the mandibular, we are going slightly deep and slightly towards the medial side. Okay, and very carefully as we are going deep, we are checking the lateral view again and again for the search of the mandibular division.
Excuse me, sir.
Now,
medial,
see,
you mean?
Here is the motor division. Okay, so you are able to see some amount of motor twitches here. Yes, Lokesh,
Hello.
something. Yes.
Sir, you medial means to medial end of the foramen ovale. You mean to say towards
Yes,
more medial
medial
side of the
side of the
foramen?
foramen oval. Yes. Okay, so now we can see the stimulation in the motor. So even though we are have put along the maxillary paresthesia, but as the structures are very close, so some amount of masseter temporalis contraction because of the mandibular stimulation will also be there. But remember, for the perfect position, we need to check for the paresthesia, okay, whether it is matching with the area of pain or not. Okay, and see, so the location should be, see, here we are able to see the stimulation. Wish we could have done the stimulation more to show you. Okay, actually once the stimulation came, we just moved on. Anyway, so after this, see, this is the foramen oval and this is the needle tip. Next is the injecting a
Excuse.
very small amount of local anesthetic before. So I am asking the patient about the paresthesia here. Then we will be putting small amount of local anesthetic, usually 0.23 ml is good enough, and we will be giving very slowly 0.1 ml like that. And now again we are putting the probe for the radiofrequency procedure. So now you can see the first lesioning we are doing at the 65 degrees Celsius. Our preset is 65, so it will be moving something around 65, 66 level. Once the initial lesion is complete, then we'll be moving towards the next lesion at 70 degree. See, the next lesion is we are doing at 70 degrees Celsius, and we have also done the third lesion at 75 degrees Celsius. Some books recommend an intermittent lesion at 72 as well, if you want to do 4 lesions. So after we have done, see the smiling face of the patient even in the table when we have not removed it, because she is suffering for long. So I asked, why you are laughing? So she is saying that because I am suffering for last 4 years now, I have no pain. Only there is heaviness. So at the end, we are taking out the needle. We are checking out the corneal reflex as well. Here, definitely because of the local anesthetic, corneal reflex is reduced. And as it is towards maxillary and mandibular side, so I recommended this artificial tears for 4 to 8 times a day, as well as along with I also recommended to give at the night azithromycin eye ointment at night. This is to prevent the exposure keratitis. আর এই জায়গাটা ব্যথার জায়গাটা ব্যথা নেই তো, ওই জায়গাটা তো অবশ্যই আছে। কতটা অবশ্য হচ্ছে? অবশ্য হচ্ছে, তাই তো? চোখে কোনো অসুবিধা হচ্ছে? ঠিক আছে।